Hi, I'm Garvin. This telecast is on Antabuse. So, what is Antabuse used for? Antabuse is used in the treatment of alcoholism. It helps to deter people from drinking alcohol. So, how does it work? Antabuse tablets contain the active ingredient disulfiram, which is a type of medicine called an aldehyde dehydrogenase inhibitor. It is prescribed to recovering alcoholics to help them abstain from drinking alcohol. If someone taking this medicine drinks alcohol, it quickly causes a severe, unpleasant and potentially dangerous reaction, and knowledge of this fact can help to stop people from drinking. Disulfiram works by interfering with the way the body metabolizes alcohol. Alcohol is broken down in the body to a compound called acetylaldehyde. This is then normally broken down further by an enzyme in the liver called aldehyde dehydrogenase. Disulfiram stops this enzyme from working. This means that when alcohol is consumed, the body can't process it normally. Instead, acetylaldehyde builds up in the bloodstream. High levels of acetylaldehyde act directly on the heart and blood vessels, causing flushing, a racing heartbeat, and a drop in blood pressure that causes dizziness. Other unpleasant symptoms include throbbing headache, shortness of breath, palpitations, nausea, and vomiting. This reaction to alcohol is often called the disulfiram reaction and is usually enough to deter people from having another drink. The disulfiram alcohol reaction occurs within 10 minutes of ingesting alcohol and may last for several hours. It can be potentially dangerous. For some people, knowing that they can't drink alcohol without having this reaction is what is needed to help them not to give in to temptation in a weak moment. When starting this medicine, you must not have drunk alcohol for at least 24 hours. You must not drink alcohol for 2 weeks after stopping the medicine, as the reaction may still occur in this time. It is important that disulfiram is used in combination with other forms of therapy and good social and psychological support to help you remain alcohol-free. So how do you take it? It is important that you have not drunk alcohol for at least 24 hours before taking the first dose. Antabuse tablets can be taken either with or without food. They should be swallowed with a drink of water. If you forget to take a dose at your usual time and it is more than 12 hours late, you should just leave out that dose. Take your next dose as usual when it is due. Do not take a double dose to make up for an earlier missed dose. It should be used in caution with people with liver disease, disease affecting the lungs or the airways, respiratory disease, kidney failure, epilepsy and diabetes. And is not to be used in people who have had a stroke, coronary heart disease, heart failure, high blood pressure or hypertension, people with psychotic illness or severe personality disorders, people who are at risk of suicide, and hereditary blood disorders called acute porphyrias. It's not to be used in breastfeeding. This medicine is not recommended for children, and this medicine should not be used if you are allergic to any of its ingredients. So for pregnancy and breastfeeding, this medicine should only be used during pregnancy if the expected benefit to the mother and developing baby is greater than the possible risk to the baby. It should be avoided in the first trimester. So there is no information available about the safety of this medicine during breastfeeding. For this reason, it should not be used by breastfeeding mothers, particularly if there is a chance that it may have a reaction with any medicines that the baby is taking. So seek further medical advice from your doctor on this. So the main side effects would be drowsiness and fatigue, particularly at the start of treatment, nausea and vomiting, bad breath, decreased sex drive, mood changes, strange or abnormal thoughts, paranoia, mania or depression. Tell your doctor if you think the medicine is affecting you in this way. Also, side effects, allergic skin reaction, liver problems, inflammation of peripheral nerves causing symptoms such as pins and needles or numbness, inflammation of the optic nerve. So how can this medicine affect other medicines? Alcohol-containing medicines, certain liquids, medicines and remedies, tonics, mouthwashes, toiletries and aerosol sprays may contain sufficient alcohol to cause the disulfiram alcohol reaction. Make sure you check the ingredients or ask your pharmacist for advice before using any of these. Disulfiram increases the anti-blood clotting effect of the anticoagulant warfarin. If this medicine is used in combination with warfarin, your doctor may need to decrease your normal dose of warfarin to avoid bleeding. Disulfiram can slow the breakdown of the following medicines by the body. It may increase risk of side effects from these medicines: aminophylline, benzodiazepines such as chlordiazepoxide and diazepam and temazepam, phosphenotoin, phenytoin, theophylline, the tricyclic antidepressants such as imipramine. So if any of the following medicines are taken in combination with disulfiram, there may be an increase in confusion and changes in mood. The isoniazid, metronidazole, paraldehyde and amitriptyline may increase the effect of disulfiram, and people taking amitriptyline may experience a more intense disulfiram alcohol reaction if they drink alcohol. So if you have any questions, you can contact me through the Life Pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.